how to make 250 grand over the weekend.
A lot of the innovation and sort of new progress is coming from smaller companies and smaller distributorships, and they're the ones who are pushing to make improvements for patient care and patient safety that is outside of the mainstream.
It takes a stunning amount of arrogance to develop extras for customer service because you are treating your extorted payers so poorly. Payers, not customers.
That's what's become a cash grab for a lot of these companies. Instead of enhancing patient safety, they're creating obstacles to performing these cases safely and making it difficult for everyone to do their jobs, from the reps themselves to surgeons who rely on them or staff that relies on them to help get these cases done efficiently.
I wish I was making this stuff up, but it's real.
The scary thing now is that a lot of these facilities are just going to create their own vendor credentialing systems and just collect 100% of the profit rather than just a portion of the profit.
You can't replace part of the brain. Like, you
treat them the same.
Source of truth for the MedTech industry.
Coexists with the profits.
Robot understands things automatically.
Number one show in the MedTech industry.
So Stryker got ahead of that and changed in the $90 billion company. They had help up high, a lot of things.
State of MedTech with your host, Omar Khateeb.
What's going on, everybody? Welcome back to the show. Happy New Year. Starting off with a bang. So this has been a topic that I followed closely for a number of years, which is essentially this whole sort of saga and drama unfolding around vendor credentialing, the way that reps are essentially treated in the hospital. And so a big shout out to the Matt Device rep and also the Red Hat gang who made me aware of the situation a couple of years ago. When I was a rep, we had some level of vendor credentialing, but not the way it is today. And so, of course, for this kind of thing, there needs to be one person who really spearheaded the investigative journalism side of this. He happens to be doing this as a side quest to his main gig, which is being a fully practicing orthopedic surgeon. So we're joined by Dr. C. Brian Blackwood. Dr. Blackwood, it's so great to see you. Thanks for coming on the show. I'm glad we were able to make this happen. How are you doing?
I'm doing well. Thanks for having me on. It's an honor to be on the discussion here and to see where we go from there.
Totally. And like maybe a good place to start is like maybe give us a little background for the audience who doesn't know about you. Tell us a little bit about yourself in terms of your, clinical training and what your practice is like today, and we'll kind of segue from there into the topic at hand.
Okay, yeah. So I'm an orthopedic surgeon in Boulder, Colorado. I did my medical school at the University of Washington. After growing up in Montana, that was the school that everybody went to. Connection there to go to Seattle and get trained for medicine. Then went to an orthopedic surgery residency at the University of New Mexico in Albuquerque. Great training in trauma and sports and joints to some extent. I got a lot of early exposure. And then did a joints fellowship in St. Helena, California with Tom Kuhn and Adam Friedhand, learning direct anterior hips, a lot of short stay, robotics, technology. Really was sort of one of the first people to get that level of training, fellowship level training in robotics as far as it went for hip and knee replacement. And then stayed there for a year actually, and then transitioned to Colorado. My grandparents had lived just north of Boulder, and so I was very familiar with the area. Decided to set up practice in Boulder since I didn't have a fellowship trained joint surgeon at the time. So it was a great fit for me.
Fantastic. So you're practicing orthopedic surgeon. So what did you know about, well, let's first of all make a definition. So all the reps know exactly what this is, but there's a lot of executives, a lot of people in the industry who don't know about it. So like, what exactly is vendor credentialing? Let's start there.
So vendor credentialing is important. So this is making sure that the medical sales reps that are going into the hospital to help us, throughout the cases. So there are medical reps that come into the cases and sort of help make sure the cases go smooth, make sure we have all the equipment available, make sure the implants are available. And so they have to be, made sure that they aren't slipping through the cracks as far as having all their ducks in a row. They need to make sure they don't have any criminal records outstanding, make sure their vaccinations are all up to date, make sure that they're passing drug tests. Actually, they take more drug tests than I do. I don't think I've had to take one in the 13 years I've been in Boulder, but they're getting, yearly at a minimum tested for 10 different substances. And so the idea is just to make sure that these aren't people just wandering in and that they're credentialed to be where they're at. They have some special training they do as far as HIPAA compliance and bloodborne pathogens, and just so that they're not just in off the street, so they understand what they're getting into and how to do it safely. And ultimately, this is all for patient safety, and that's what we're looking for there. So it is a very important thing. But vendor credentialing has become kind of this blind spot where the C-suite doesn't know about it, the surgeons don't know about what it's become and what it's morphed into. So it's gone from being sort of a check-in. I think the way I used to think about it a decade ago was, oh, you guys sign in, sign out, which is what is required. And then, make sure that you're doing everything safe, and they paid, a couple $100 to be able to have this facility and check into all these different areas. And make sure they were safe. And now it's sort of morphed to there's, half a dozen or more of these vendor credentialing companies charging $500 or $600 a pop to everybody each, so that this is adding up to $3,000 to $5,000 per rep. And there's thousands of reps out there. So it's become a cash grab for a lot of these companies to create, instead of enhancing patient safety, they're creating obstacles to performing these cases safely and making it difficult for everyone to do their jobs, from the reps themselves to surgeons who rely on them, or staff that relies on them to help get these cases done efficiently.
Yeah. And, I remember back when I was a medical student, being able to just walk into the hospital and go straight to this surgical suite and walk into the doctor's lounge, put on scrubs, and just tell the nurse in front, I'm like, oh yeah, you're see Dr. So-and-so. And they're like, yeah, go for it. And just walk into the room. And so I remember even back then I was like, okay, this doesn't seem safe. And so it's good that they have credentialing systems. You kind of need that these days. But yeah, it's gotten to a point where now I feel like it's a hindrance even on innovation, because if you're a Boston Scientific, a Stryker, a J&J, sure, it's not great, but you can write that off. But if you're a startup and you're trying to drive clinical adoption of a new technology, you just can't do it. You can't afford to do it, including you think about distributors, and I don't know exactly the number, but I think there's probably a pretty large percentage of medical technology that essentially is represented and implemented outside of, let's say, the magnificent 7 or 8 strategics out there.
Yeah, there's a lot of big companies out there that are well established, that are able to kind of write this off as a cost of doing business, and you can see how that could maybe make sense. But a lot of the innovation and sort of new progress is coming from smaller companies and smaller distributorships, and they're the ones who are kind of pushing to make improvements for patient care and patient safety that is not as outside of the mainstream. So it's a little bit of that innovator's dilemma, where these big companies maybe aren't innovating as actively because there is some risk involved in that, but these smaller companies can be more nimble and do that. But then it becomes an obstacle to get on the playing field if the barrier to entry is too high, if they're having to fork out a bunch of money just to be able to bring their products to the facilities and to market. And their goal is to help patients, and that's what we all want, is to have patients do well.
Absolutely. So let me ask you this: what first motivated you to essentially speak about this? So speak out about it publicly, because you've been very public on LinkedIn. I have to admit, I know you're a surgeon, so there's technically nothing for you to lose, but it still takes a lot of courage to post so publicly and call out these companies and the CEOs and the founders of these companies. So what can you take us back? What happened specifically that made you say oh, I didn't know about this, and made you start digging into it?
Yeah, that was the big thing, is I didn't know about it. And so our good friend, Johnny Gaffaro, kind of pointed this out to me and was like, hey, he's traveling all over the place, and he's at a small startup, and he's showing me all these obstacles that they have to be able to get into these places. And it was just a total blind spot for me as a surgeon. I just thought the reps came in, and we don't have even red hats at our facilities. We don't have rep scrubs at our facilities. We just have the stickers. And so I didn't understand how bad.
Explain to people who don't know, what is the red hat?
So the red hat, everybody wears sort of a cap when they're in surgery. And so there's the traditional surgeon's cap, which is sort of tight, and not too many people wear those. And there's sort of these bouffant style that are a little bit bigger, and they're usually blue or sometimes white. But then they started having them wear red to sort of identify them as different or outside or medical sales reps. Just sort of the idea, I think, was a reasonable one to make sure that they're identified as what their job and role is. And there is some evidence that if you identify everyone in the room, that helps to do that, but you should make sure everyone in the room is doing it, not just the medical sales reps. So it was some way to kind of segregate them a little bit and sort of identify them quickly. And I think that most people are okay with the red hat thing. They kind of shrug their shoulders, and it's, a little bit disappointing. Where it takes to the next level is these rep scrubs, which are these paper scrubs, literally made out of the same material they use to blue wrap and sterilize the trays. And they make people check in and pay a subscription fee plus $10 a day to wear them. And there is a video that I posted where there's a short sleeve version, but apparently most of them are long sleeve versions, and they're not very good quality, so they're tearing constantly, and they're supposed to expire after 8 hours. And the goal being that somehow originally they were supposed to help reduce infection, which they showed that did not happen. And now they're using the excuse, well, it is a double check on compliance to make sure that they're checking in and verifying that they're doing what they're supposed to be doing. And I don't think it does that either. So these are the things that they're doing to sort of show people as others that are not part of what there's the employed hospital system or the doctor-patient care team.
Interesting. Yeah. What's funny is, it's almost comical. Can you walk us through a little bit so that the audience understands this as well? So then I'm a rep. I show up to the hospital, I have to pay this amount of money on a monthly, annual basis to show that I'm credentialed. I don't have any warrants out for my arrests. I have my vaccinations, everything. I've done my HIPAA compliance, all these things. So I go to the hospital. I'm going to cover Dr. Blackwood's case. Walk us through the actual workflow of what needs to be done and what happens.
Yeah. So what people see is that there's people in the room opening boxes. And so they get sort of labeled as this box opener. What's actually going on is that they're bringing in sets, they're bringing in materials, they're keeping track of the implants, they're keeping track of the equipment, they're making sure that it's set up and ready to go. We're doing 9 or 10 joint replacements in a day. That's a lot of equipment and materials. And so there's a lot of potential for things to go wrong. And so it's an added almost workforce for the facilities that they're not having to pay for to make sure all these cases can get done. So they're some of the more motivated people to make sure that the day goes smoothly. And so they want the scrub tech to have a great day. They want the nurse to have a great day. They want the doctor to have a great day. And then ultimately have the patient to have a great day and a great outcome. And so they're behind the scenes doing a lot of work that isn't seen, moving around sets, making sure all the equipment's there, making sure all the implants are available, making sure what we need as a team inside the OR to perform these cases is readily available so that the patients can have these improved outcomes.
Got it. And also, just so everybody knows, for those who are watching on YouTube and Spotify, I do want to show what this looks like. So let me know, Dr. Blackwood, when you see my screen. We're going to use our buddy Eric Anderson's account. Can you see my screen right now? Okay. Here's what those scrubs look like. So again, it's like really cheap paper scrubs, often oversized. So I think you had mentioned, as well, that like a lot of times all that's left is like a triple X or like a triple small. And tell us a little bit more. I think you looked into the actual safety of these and are they actually safe? In the sense of like preventing infection. So like maybe you were told about an issue. You're like, I didn't know about this. You started digging into it. What did you start uncovering?
Yeah, that was the crazy thing. I started digging into this, and every sort of rock I looked under, there was just more corruption than just these terrible ideas.
What was the first one that you lifted up and you're like, or like, to change another analogy, what was the first thread that you pulled on that you're like, oh wait, there's more, and that caused you to start pulling more and unraveling this thing? What was that very first thing?
I mean, the very first thing was the rep scrub guys reached out to me to have a conversation about it, to see what they're going on, try to share their side of the story. And it was just nothing really tracked and made sense. And there was a little bit of a push. They're called the reps customers, even though they definitely treat the facilities more as a customer. So even though the reps are the ones paying, they're not providing great customer service. Like you said, the machines are not always stocked. They're usually the extremes of sizes. Apparently you get dinged if you get the wrong size than you usually would do, because they think you're trying to get a scrub for somebody else. So there's a lot of these the system's just not set up very well. And the excuses that they would come up with as to how they came up with it was like, oh, there's a sob story, but initially about how they saw cat hair on a scrub from a rep and how terrible that was. And then it pivoted to, oh, well, now they bring these scrubs to their house and they're not clean and they have all these terrible bacteria on them and they're not sterile and it's a risk for the people at home. And then it was the pivot to well, this is helping for compliance, and this is really a compliance issue or a scrub loss issue. That's one of the favorites is, oh, we're saving so much money on scrubs. The facilities are losing because of the reps are taking them. And the first people I see most wearing scrubs outside of a facility are physicians. So they're the ones I think that are most at risk of scrub loss. I think when I was a medical student, I remember I had a giant pile of scrubs in my room at home. So I brought them all back and they got laundered and taken care of appropriately. But physicians are as guilty as the reps in that aspect of things. And so but they can't make us wear those. So they're making the reps wear those. And they just kept looking there. And then it was talking to Simpler and IntelliCentrics. They had a merger that is apparently still ongoing.
There are different vendor credentials. I want to be fair in the sense that like Rep Scrubs is like one of those vendor credentialing systems, or are they the main one? Like how do we?
They're a credentialing company. They're just a compliance addition. They're just a scrub supplier. They don't do any of the actual vendor credentialing. So they've managed to sort of piggyback on this idea to try to extract, that the facilities are losing money, and they're helping to save that and solve a problem with compliance with making reps check in. So it's a pretty messed up system when you start to think of how much money every day these people are having to pay if they have to go to multiple different facilities just to check in and off. And they're not even going into cases. They're picking up the equipment, they're dropping off the equipment to get it ready for cases or when it's done for cases, and they're still making them change into these rep scrubs and do that kind of thing.
If you're a CEO of a MedTech company and you just got ghosted by another investor this week, or maybe a strategic that you're trying to have a meeting with just kind of brushed you off at a conference, and you're just sick and tired of all this, you want to make these people pretty much eat their words, right? I think I have something for you. Here's the uncomfortable truth. Most MedTech startups don't fail because of product. And trust me, I can confidently say this after interviewing so many different startups on the show, investors, strategics. A lot of them fail because the market never really formed around them. My obsession with technology adoption and, more importantly, market engineering has sort of taken shape over the years into my business called MarketCraft and recruiting a top tier team around me for that. And MarketCraft, we're not just about digital marketing and campaigns and everything. We focus on engineering markets. We use AI-trained models, psychology, persuasion, and strategic storytelling to manufacture something that every single CEO needs, and that's leverage. We want to give you leverage with the market, so by creating magnetic messaging and attention, we can shape a belief system that is going to attract and magnetize those early clinical adopters to you. We want to give you leverage with investors because when your category narrative is very clear and your demand signals are loud and you can show this early clinical pipeline, and then at that point, capital start to chase you instead of the other way around. Now you have options. And then leverage with strategics. Because look, when you show a strategic, and trust me, I've had many conversations with them on this podcast and offline. When you show them that you're starting to own momentum in a space that they care about, you don't just look like a startup to them anymore. Now you look more like a partner. And if you do it really well, potentially competition they need to take out, right? So if you're an early stage MedTech CEO and this all resonated with you, I want you to stop what you're doing, put pause on this podcast, go to growmymedtech.com. That's GROW, growmymedtech.com. I want you to book time with me. Okay, we're going to do a little bit of a market analysis for you. I'm going to come to the table with 2 to 3 really good ideas. There's not a guarantee that you guys might be a fit for us. It could be the wrong time, a lot of things like that. We turn away more companies than we take on. But I can guarantee you that you're going to walk away with 2 or 3 really good ideas for free, and it's going to be a good conversation. So go to growmymedtech.com. I'm really looking forward to talking with you. And more importantly, you can feel free to vent to me about all the problems that you're having, because at MarketCraft, we want to come and solve those for you immediately. Now, let's get back to the episode.
Do you feel like what started off as a reasonable endeavor, which is like, hey, so let me take people back. And again, I for those who are watching you, we have a new studio. If you watch this on YouTube and Spotify, you should always check the desk because I'm always going to have some new books relevant to the topic. So like, I have this great book, The Salesman Surgeon, written back in the 70s and 80s. So when U.S. Surgical and other companies, Stryker, et cetera, really started getting a boom, the big thing when it comes to selling was like, be in your account and sell, right? And there was no barriers, right? And so there was a period where like, people would be hanging out in the hospital, in the cafeteria, in a variety of places, and it got a little out of hand, right? And especially as like you added more and more companies to the market. So it's understandable that hospitals were like, hey, we need to kind of control this and make sure that the people who are here are actually here. They're not here like selling, you know? So that's understandable. Do you feel like that sort of something that had a good intention now sort of opened the door for all kinds of people and companies to take advantage of this, which is like, oh, like, let me, you know, if you're going to do this, we should add this thing. Do you feel like that's kind of how this all sort of got out of control?
Yeah, I think that there was definitely some wild stuff back in the 70s or 80s that the reps were doing as far as getting involved in surgeries or being hands-on or just being always at the facility and always selling and then trying to cause problems that way. So I can see where they needed to have this system set up. But it's like so many things in medicine, whether it's health insurance or these pharmacy benefit managers or these group purchasing organizations, they start off as a good idea, but then people find out that they can make money doing it, and it really sort of morphs into something else, and people start taking advantage and focusing more on the profits than the main reason that they've started, which is this patient safety and making sure that everyone's where they're supposed to be.
Yeah, what I was saying is like you've talked about how systems in healthcare disadvantage reps and surgeons alike. Like, to what extent do you think credentialing is just one symptom of a larger structural problem?
I think it's a huge step for that, and really kind of a smaller. People ask me why I'm so interested in this, and there's so many, I guess what I describe as kind of leeches in the system that are everybody's trying to extract value from what healthcare is doing, which is to have healthcare providers, physicians, PAs, NPs, nurses take care of patients. And there's so many people jumping in the middle as third parties who aren't providing any of the care, but are extracting a lot of the profit. And so I think the better credentialing is sort of a small portion of that. Then you get up to those, like I said, the PBMs, the pharmacy benefit managers, the group purchasing organizations, and then even to some extent hospital administration or sort of these large corporations that are taking over hospital care, and they're trying to extract their amount of profit. And that's why the system is so expensive. And so this is kind of chipping away at some of that to work to some of the bigger problems. Is we need to get rid of all these people who have their hand in the pot for healthcare, and really allow people that are actually taking care of the patients to be rewarded for that, and that'll be how we lower the cost. Get rid of all these people that have their hands out and are just taking money from the system and not adding value to it.
Right. And what I find interesting, again, like I really admire that you did this, and I'm just pulling this up on my end, is like you've taken like direct shots on calling people out. So like as an example, I'm gonna read this post. How to make $250,000 over the weekend. Number 1, switch vendor credentialing services on a Friday, effective following Monday. Step 2, add one specific question related to facility that reps already enrolled and cleared couldn't have previously answered. Step 3, state it will take 7 to 10 business days to process. Step 4, offer to expedite processing for a small fee, say $100 for 2,500 reps. And voila. And then you called out impressive green security and UC Health. I'm sure there is no kickback or rebate involved in the changeover decision-making processes, right? I wish I was making this stuff up, but it's real. And you actually took screenshots of this. So again, like you're taking time out of your practice to call these like entities out and everything. First of all, like how did you hear about this, and like what motivated you to make that post?
I mean, once you can imagine that once I start talking about things, then people are followers, or I've been able to network with a ton of different people on various levels, and they'll send me this information. And so this was somebody reached out and was like, "Hey, have you seen this?" And so I looked into it and was like, "Yeah, they're switching over from a different vendor credentialing company to Green Security. They're doing it." And they had given notice, but they had sort of given this final notice about this question that got added in on literally a Friday. And it was a silly question. It was like, are you related to somebody who works at UC Health? Like has nothing to do with patient care, nothing to do with making sure you're appropriate to be there. These people are already credentialed with the system from other facilities. But obviously, when you're making a switch, you can't anticipate that you need to check a box for UC Health if they're not part of the screen security system. And to have that sort of come out that way, and it made a difference because suddenly they sent out a follow-up that was like, "Oh, well, we'll give you 2 weeks to get this done." All of a sudden, and it's like, "Oh, you shouldn't have it where it takes a week and a half to process unless you pay us $100 to $150 for this special emerald level green security thing. So then we'll give you good customer service." That should not be how you treat your actual customers who are actually paying you. And then to go with the question of kickbacks, I asked another facility, like, "Hey, when you guys switch to this green facility, do you guys get a rebate from these companies. Like, well, yeah, through the GPO, we get a rebate. I was like, and do you pay anything for these companies? Oh, no. So they're getting a rebate on something they're not paying for, which seems like a kickback, basically by definition. That if you don't pay for something but you get money for using it, that seems like a kickback.
Yeah. No, I agree. And something else I kind of wanted to bring up, if you can kind of walk us through this, I thought this was also really interesting. Yeah. So essentially, I just want to make sure I understand. So like you showed this vendor credentialing cost. So you have like all these different vendor credentialing companies and the annual cost per rep. So essentially, like, is this on average? Is this so you, all these things added up, right? From like, getting scrubs to the actual credentialing stuff, a scheduler thing, I don't know, all these, it's about $5,000. So are you saying that like on average, every rep is paying somewhere of $5,000 a year? Is that like the average or?
I mean, I would have to say if you're going to multiple different facilities and having all these different, each facility has their own sort of credentialing system that they're using, that this is not unusual. And that doesn't even include that list that you showed, doesn't include the daily rep scrubs $10 thing. So that'd be, another $3,600, dollars that add up real quick.
And for the people who don't understand this, by the way, just to sort of add, we're just talking about the credentialing stuff. This isn't counting also like reps having to pay for parking, right? So parking is one thing. So parking is important because especially if you're an orthopedic rep, like you're carrying a lot of trays, right? So the parking is one side of it. Obviously, food, you're paying for the reps' food on site. I'm sure there's other things that I'm missing, but all this stuff kind of adds up.
I mean, one of the most amazing things I heard one of the reps shared with me, again, UC Health, in a different facility outside of the metro area, very hard to get to facility out in the middle of nowhere. And they had a new way for the reps to check in. So they had to park far away, pay for the parking, walk in, check in for their rep scrubs, walk back to their car to get all their stuff, then walk back into the area to drop everything off, and then go back and check in and go around. It's so ridiculous. These people they're trying to help. They're bringing in equipment that we as physicians request. They're in the rooms by our request to help us make sure everything goes smoothly. And they're being treated, like second-class citizens, like they're not a part of the team.
Yeah, no, and again, like I think that's something really important to point out, which is like there's always been this like thing that comes around every like 5-10 years, which is like there will be no more reps in the OR, right? And I feel like that always comes from people who don't actually understand how all of this really works,
Yeah, I mean, they tried that at Loma Linda, and they were very loud about it. We're going to go to this repless system, and then they very quietly stopped.
Tell us a little bit more about that. I did not know about this.
Oh, yeah. So there was a facility that very loudly, like a decade ago, said they were going to switch to this repless system. And so this was, the hospitals were all getting very excited about this. And maybe we can get rid of all these reps and thinking that they're adding the cost onto the implants. They're going to save money on implants by not having the reps there. But then they realized there was nobody who was as invested to actually keep track of the equipment, keep track of the implants, keep everything running smoothly. And so they very quietly shelved that program and went back to the standard quo. And I realize there are reps who bring this on. There's some bad apples out there, but I've traveled all over the country, trained surgeons on different surgical techniques, and interacted with a bunch of their reps. And a lot of them are not getting paid for the labs that we're doing. They're not getting paid for that time. They're trying to help their surgeons get better at what they're doing, get these better technologies. And they're good, hardworking people. They're in there, putting in their time, putting in their effort, and they're not making huge salaries like they were when they were scrubbing in and doing the cases in the 80s. I mean, they're not making a ton of money. They're making decent money, but they're also putting in long hours and hard work. I mean, they got to get up at 5 to get there before I get to the hospital at 7. So they're getting everything set up at 6:30, making sure everything's running, staying there well after I'm gone, making sure everything's clean and set up for the next day. So this is hard work. This is not something to take lightly. Those trays are heavy. They got to move those around. This is real, legitimate hard work that they're getting reimbursed fairly for. But they have a target on their back because it's hard to see the value if you aren't there looking at it.
Yeah. Do you feel like, on one side, it's frustrating to see how like different companies have taken advantage of this, but essentially it's a marketplace and a business model where it's like everything is legal, right? Do you put this more on the hospital systems and facilities not respecting that relationship and then trying to just extract whatever they can? As a result of that, you've had, these different business models pop up that are very extractive.
I think so. I think it's they're not going to the C-suite level people to come up with these plans. They're going to sort of the OR managers and sort of some middle managers who may feel like they're just looking at numbers and not understanding, and maybe they've had some frustrated dealings with reps before, and so they kind of want to stick it to them a little bit and feel that this is a way to do that. And so these companies come in offering money that's coming basically circuitously from the reps as a kickback. And so this looks appealing. The scary thing now is that a lot of these facilities are just going to create their own vendor credentialing systems.
Right.
So they middleman and just collect all the 100% of the profit rather than just a portion of the profit. I think HCA is already trying to do that with their own sort of system. And so, so HCA has set up their own True Access or something. I think that they've set up to do that. What's weird is that there is a standard. There's an ANSI standard for what they need to do. There's a credentialing, Universal Healthcare Credentialing Coalition that's working to get this. This should be something where the reps can pick who they want to do their vendor credentialing, and then there should be reciprocity across the board. If you do it once, it's not different. They're not doing anything new and exciting. So long as all these companies are meeting the same goals, then they should be able to check in really with any system and sort of understand that they've done this already. They don't need to do it again.
Yeah, because I know that if you can kind of give somewhat of an update, I know that AdvaMed released a letter about this, which I thought that was like a good, because again, like I was just like so impressed by how the MedTech community, especially the orthopedic community, seems to have really jumped on this. I know Ira Kirschenbaum and Joey had a open mic topic on this, which I thought was good. My only thing was like at the end of that, I didn't contribute on that. I was just a listener, but my only thing was just like, okay, like if this is really that big of an issue, like the next step is like go to AdvaMed, who's responsible for advocating for our entire industry. So maybe, do you have any updates from them?
Yeah, so there's been a big push on that. So AdvaMed actually submitted a letter last year to the Department of Justice and the Attorney General to have the OIG look into this. Their OIG has already looked into 2 different complaints already and given unfavorable opinions to things like making the companies pay to have their equipment cleaned and ready for use, that they're trying to offload that cost onto the companies instead of the sterile processing department at the facilities. There was a company set up to do that, and that was evaluated by the OIG and given an unfavorable opinion of that setup. As well as now there's third-party, it's amazing how many things are out there. There's a third-party billing system where instead of submitting your purchase order to the facility, you've got to sign up with a third-party biller that then does all this work for you, but it costs the companies extra money to sign up for these different third-party billers. And that was looked at by the OIGs and given an unfavorable opinion. And so I'm thinking in the next couple of weeks or months, there should be an opinion given since AdvaMed submitted to have the DOJ look at this and the OIG overall for vendor credentialing and the added cost and minimal value that it creates, as well as a sort of restraint on trade and an obstacle for getting these companies into facilities that are taking Medicare and Medicaid money. And AdvaMed was very good at getting that out there. AUKUS with Michael Meneghini and Corey Calendine sent in a letter of support. And so I think there should be an interesting ruling coming down. My guess is in the next couple of months, looking at that as well. So there's definitely some serious momentum. It's sort of amazing to take a step back and look at a year ago where this started and where it's at now. But there are people taking real looks at this, and the government's looking at how this is impacting things. So this government currently does not look kindly on people extracting value without giving value. So they don't want you to profit off of things if you're not actually bringing value to the table.
Yeah, I make a little bit of a prediction on the show about 2026. So over the last many, many years, it was just like a thing. Like fraud was just part of the government. I mean, USAID is a great example of that, these NGOs, et cetera. And I think in the last couple months, specifically like what's been going on in Minnesota and, the upwards of $9 billion of fraud from home health care and child daycare centers showing up there. I noticed something on X, which is it seems like more people in government, like mayors and governors and everything, are starting to be vocal about finding fraud within their state. So now it's become like a game or sport, like how much fraud can I uncover over you? And so as a result of that, now the incentive is like, oh, if I find fraud, that's going to be a good thing. Plus, not to mention, I think there's a startup I found, because apparently when it comes to finding finding some level of fraud within the federal government, you're awarded somewhere of like 20 or 30%. So if you find like, $100 million of fraud, like you might be awarded 20, 30 million. It's a hell of a startup, right? So there's actually a startup who's focused on this. And I was just saying, I'm like, oh man, I feel like there's a whole lot of fraud in healthcare. Like not just on the healthcare insurance side, but like on this side as well.
I mean, I think you could get 20, 30% of go from millions to billions. I mean, there's so much that's out there when you start looking at how all of healthcare is structured and sort of all this vertical integration that's gone on, and how they're circumventing sort of, minimum medical expense ratios for insurance companies and paying themselves, and these PBMs that are taking rebates meant for patients for themselves. And I mean, that's a great startup idea to be able to look for that, because we all know, I think, that the government is not the most efficient in the world. But when you start to look at how many people are just blatantly fraudulent involved in that, it can be kind of scary. And so I think it's great if we can start shining a light on some of this stuff. And like I said, you start pulling on strings, you look under rocks, it's amazing what you find.
I think the company's called, here we go. Yeah, here we go. It's called antifraudcompany.com. We defend your tax dollars. Yeah. So this is a startup, like a young guy, Alex Shee. So I'm going to try and get him on the show, because I'd love to talk to them and see like what they found in our industry. Maybe those are the people that we need to turn loose on this whole vendor credentialing issue. Yeah.
It sounds like it. I mean, especially if they can figure out how they're taking advantage of the system and bringing fraud to the government. So
you got, I mean, your posts really went viral on LinkedIn. We're talking about tens of thousands of people who engage with them. So obviously the industry loves it. What's been the response from like your peers, other surgeons and hospital administrators, because we're not privy to that. What's that been like?
I think it's been quite an impressive response. A year and a half ago, I wasn't even doing anything on LinkedIn. And that kind of started toward the end of 24. And then 25, all of a sudden it caught fire. And I had posts go 600,000 impressions, 400,000 impressions. I mean, these were making some big marks. And I think for the year, it was like over 4 million or something. It was just crazy numbers to think about. And so suddenly that got my name out there. And so it was very interesting to go where people knew who I was that I didn't necessarily know or commit to, but mainly these people coming out showing appreciation that I was speaking up for them. Other surgeons, I think they talked to me about it. Said, I just didn't know this was going on. I think it's been such a blind spot because, as you say, we're busy. We have our own things going on. I've got my job as an orthopedic surgeon, my wonderful wife at home, the 5 kids. It keeps busy. I've got a lot of other stuff going on, and this is just sort of come out of nowhere as something that I've become a leader for. It's just trying to shine a light on what's going on, and hopefully change comes after that. But it's been good feedback. I tried one of my CEO's hospitals is on the American Hospital Association board, and he didn't even know anything about this. So I think trying to get the exposure to some of these people higher up and be like, hey, this is a real thing. Like, I realize it's not curing cancer, but every little bit helps to kind of streamline the system and make things more efficient, and just to not exploit people and not take advantage of people is an important thing.
Absolutely. I want to read through one of your other posts. Again, I think your posts are really good about capturing like moments in time. This was posted about half a year ago. So you wrote that it takes a stunning amount of arrogance to develop. And I'm reading this word for word because, again, I love the fact that you're a surgeon. You don't have to be doing this, but not only are you reporting on this, but you're like really being candid and calling it out, very much like a surgeon would, which I love. You wrote, it takes a stunning amount of arrogance to develop extras for customer service because you are treating your extorted payers so poorly. Payers, not customers, because the true customers are the facilities receiving kickbacks from the sham that is vendor credentialing for medical sales professionals. This is what happens when there is no competition or respect for the people paying for the service. Rather than being forced to improve their customer service to earn business, they arrogantly think that they can upcharge it for pure profit. What started as a compliance has become a money-making scam of huge proportions, as Jay Pendleton and Cheryl Halbert pointed out last week. It's time for some oversight and change to the system. There is a better way to achieve compliance without exploiting those paying the bill. And then you go on to call out, which I do love, GHX, Green Security, any response to this nice touch, including figs instead of rep scrubs, though. If you could comment a little bit on that.
Yeah, I mean, this is the thing. They now started to make it so that they do such bad customer service that they want you to pay to be able to expedite your service. It's like if I like, hey, my customer, dude, I'm having a problem with my phone. Oh, I would help you in 2 weeks, but if you pay an extra $150, I'll get it done this afternoon. I mean, it's the exact kind of thing. It's ridiculous that they are adding on these costs. I had another example. Another person reached out, was telling me, they had everything set. They uploaded their flu shot, and every facility on their Green Security was checked yes, except for the one they had to go to that day. So for some reason, again, not to keep beating up on UC Health, but it was UC Health. And he called the company and was like, hey, I'm checked clear on everything else. Why is it not on UC Health? Like, well, it just takes a few days to get this going. And, we could expedite that for $150 if you sign up for this better fee service. And he actually was like, okay, I'm going to tell Brian Blackwood about this, and then you can see how long it takes you to get this done. He literally hung up the phone after being on for 15 minutes and logged back into his account, and it was clear because he used the boogeyman of Brian Blackwood, the investigator, orthopedic surgeon, as going to discuss this on LinkedIn. And that made them suddenly be able to do good customer service. So shining a light on that stuff and really kind of spotlighting it, I think does make a difference.
I mean, I think there's something said about the new age of independent investigative journalism. You're doing that in our space in medical sales. And if you look at like somebody like Dick Shirley, who's just like young 20-year-old kid, he's got a YouTube channel and started covering this massive fraud happening in Minnesota. I think the unique thing about independent investigative journalists is that, for the most part, if you're an investigative journalist for like a major outlet, at some point you have to, like, depending on your editors, like, move on to a different story, right? But if you're independent, you don't have to move on to anything. And I remember, I won't mention who it is, but let's just say I know somebody who's an online personality and influencer with millions of followers. And he once told me, he's like, Omar, who scares me a lot? I'm not afraid of the New York Times. I'm not afraid of Fox or any of these outlets or the Wall Street Journal or Washington Post. He's like, I'm really afraid of independent bloggers. And I'm like, independent bloggers? Why is that? He's like, because, dude, he's like, every other outlet has to move on to a new story. Those independent people, they don't have to move on to anything. They'll stick it to you every week for years, and they will not leave you alone if you mess up. And I'm like, there's something to be said about that. And so, like, for you, like, you have no story to move on to. Like, you're a practicing orthopedic surgeon. There's nothing for you to move on to. So, like, you're just going to stick on to this issue,
Yeah, I mean, they could just keep until they actually improve things. Like, I got a notice or for somebody else forwarded me that IntelliCentrics is still a thing, even though they merged with Simpler, and they're going to continue acting as two different companies throughout 2026, even though they merged in 2024. It's double dipping, getting collections from both sides, even though you're the same company doing the same thing. I mean, it's ridiculous. This stuff's out there.
Wait, I missed that part. So Simpler and IntelliCentrics, whatever.
IntelliCentrics, yeah.
IntelliCentrics. So they merged. They're the same company, but now, like, if I'm a rep, for example, I have an IntelliCentrics account that I'm paying for directly, and then another account. Oh, that's diabolical.
Oh, it's crazy. Yeah, and I called them out. I talked to their old CEO, who shockingly his office is like 10 minutes from my east building. And it's amazing how many people are headquartered close in Colorado. It's kind of surprising. I talked to him and he's like, oh no, we're working to get this done by Q4 in 2025. And he seemed like a reasonable guy, but then he left, and now they're still doing it into 2026 to do this exactly what you're talking about, where they're the same company, but they're charging double for the fees. So now instead of $600, it's $1,200 because you've got to do it twice. If you can see how that adds up quickly, and I mean, I guess it pays for a merger if you want to look at it from a business side, but it's not a very ethical way to do it.
No, and I think the other side of it, so people understand, like, so large like macroeconomic impact of this is that if you look at this, let's just say like a mid-sized medical device company or even a startup, if you have, let's say, 10 reps, right? So instead of paying like $6,000 a year total, you're paying $12,000 a year, if I'm doing the math right. And so like that's money that could have been put in towards supporting a patient education event, using consulting fees to help like surgeons spend their time to do surgical training lab. There's all kinds of things that could be invested towards, and it's being lost towards this thing where you have to pay to play. Like you have no choice. You can't get around that.
Yeah, and then it's that cost is going to trickle down into the implants and materials and equipment and things that are using. This is not a zero-sum game whether it's going to take a loss on it. Everything else is going to get more expensive, and so it's not helping the economics of healthcare at all to try to extract value from others in a mildly punitive manner, and then expect that that's not going to trickle down to increased costs that's going to go on to the patients.
Do you think so? I always felt that if you look at an industry, right, the vendors that supply a customer base kind of take on, for good or bad, the personality and culture of that market, right? And so, for example, like if you look at medical salespeople, as a result of working with surgeons historically have had a very secretive culture, in the sense that like it's not so much today, but like it's hard to erase hundreds of years of history, which is surgeons get used to certain techniques, you're very private about that, etc. So as a result, like our industry is pretty dogmatic and private about things, conservative about moving on to things. So like that's one side of it. The other big side is that there's so much fraud that's happening in healthcare. I mean, think about it like from an insurance company standpoint. Like I go to see my doctor, I get this. Actually, this just happened. I'll give you a great example of this. I went to get some blood work done. I have insurance, which, by the way, there's a whole other topic I need to cover, which is I'm thinking about dropping insurance altogether and starting paying cash. There's a whole other topic.
You should try to get Chris Deacon on here. She's written a great book on all this stuff. It's amazing. Chris Deacon, have you read her book, The Great American Healthcare Crisis or Scam? Or it's amazing.
No.
You got to read the book after. Yeah, you got to try to get.
I'll get her. Chris Deacon. Okay, we'll get her on because I want to cover this topic. So anyway, I get my blood work done, and I get this bill for like $800. For like a bunch of I had some lipid panels done, etc. And my wife's like, "Oh man, like it's okay. I'll take care of it." So I'm like, "Don't pay it. I just wait." So we waited 2 months. All of a sudden, I get a new bill. Somehow magically, it got reduced to $100. So I think about it. I'm like, okay, I didn't do anything. Were they just hoping I'd be stupid and I'd just say, like, whatever, just pay it? It's all game. It's all a game, and like all the numbers on that piece of paper, for the most part, are kind of like made up. It's like really wild.
I mean, transparency in healthcare is drastically needed on so many levels, because there's the insurance companies come in and they're trying to save money for the patients, but then they have the hospitals like, okay, well, we're just going to raise our prices, even though there's really no logical reason for what they're setting their prices at, because then now the insurance companies are saving you a bunch of money because this is what your bill would have been, but look at what we saved you, even though they're actually paying more than what you would have paid if you just yourself walked over. Not everyone can do this, I understand. But say, here's what can I pay you cash for this? And it would probably be less than what you're paying for the year's worth of insurance plus deductible to be able to use this insurance, rather than paying more than what you could pay yourself as a cash pay. It's really gotten way out of control all throughout healthcare.
Well, again, I'll make another interesting prediction. I want to be wrong about this. We'll see. There's a company called TrueMed that I really like their business model. They just raised $100 million. Have you heard of this company?
Yeah, man.
Okay. So they raised $100 million. Andreessen Horowitz funded them. And so essentially what they do is they have a marketplace where you can find all kinds of different products to use your HSA, FSA dollars. And of course on X, like people posted like, this startup is literally going to show you a way to commit like legal fraud through your HSA. Because like there's some products that's, again, leave it to the internet and they'll go nuts. There was like a watch. It's not a smartwatch. It was like some kind of watch that was like $3,000, but you can use HSA, FSA money for it. So it's just gonna get so sorry. So getting back to the topic, I'm wondering, like, we have a large audience. I guarantee you, just because of, even for the audience who don't follow us, because of this topic, the algorithms are going to serve this up to a lot of people who are going to listen to it. So for the reps and surgeons like listening, what kind of practical steps can they possibly take to help add to the momentum that you've already created? I think that things really start to change when you start leveraging network effects and using like multiple people to drive the change.
Yeah, and I think, looking at that, I'd like to start with the surgeons because that's where I'm at in my field, and so to just make sure that they're aware of this, and to maybe take a step back and look around your OR and see who is wearing what and why they're wearing it. So, like I said, I think the red hat thing is a little bit, it's kind of a game, but that makes some sense. But if you look at the rep scrubs, I mean, and see where they're changing into them. There are facilities where they're forced to change into rep scrubs in the regular bathroom. There's no way that is sterile or helping you to reduce infection. So try to get those out of your facilities. These are your ORs, your patients. You're where the buck stops. You're not going to be able to say, "Oh, I got an infection because the rep was wearing rep scrubs." You're going to be stuck doing that and having to deal with that lawsuit or that patient complication. And so to see where you're at, treat people like team members. That's where this all started. Was, I think, everyone involved in taking care of the patient should be respected as a member of the team. So people that clean the room, people that clean the instruments, the scrub techs, the nurses, anesthesiologists, the reps, everybody's playing their role. We can't do this if we're not all on the same team and working together, and to acknowledge that value that we all bring. And then for the reps, it sucks, but try to be above board as much as you can, beyond reproach, to make it where it's almost embarrassing when people are trying to target you. So do your job so well with such a high level of professionalism and ethics that it becomes almost embarrassing to try to target you as a problem.
Yeah, I think that's great. That's great advice. And of all the groups that we've talked about, I mean, do you feel like there's one that's like more egregious and unnecessary than the others? Yeah. I gotta ask the question. My team made that question. I'm like, I don't know if I should ask that. I do want to know the answer to that, though.
I've actually been thinking about that because I was thinking, I should post some year in review of like awards of who's the most egregious person. And it's like, I want to give it to rep scrubs, but honestly, between the fact that Green Security came up with this customer service pay to play idea and then is blatantly giving kickbacks to facilities, and then the anti-merger of IntelliCentrics and Simpler, it's like they're tied for number one, somehow leaping across everyone's favorite punching bag, the rep scrubs, to be the worst of the bunch. It's terrible that they're able to try to set up these ways just to extract more money from people, is egregious, and really there has to be some kind of stop to this. It's gotten out of control.
I think I agree with you. It's like, again, I feel like rep scrubs gets beaten up a lot, and again, I think they have not published anything meaningful to show that it actually decreased. Okay, so like, that is what it is. But in terms of like taking advantage of the system, I feel, all right, stepping back, because obviously I have a huge bias in this. A huge bias. The expedited service is really messed up. It's a smart business model. It's terrible. It's terrible, right? Let's start.
So we can make them do what they need to do. It's bad.
But if there is a switch where I'm like, I'm going to piss off a bunch of people who like I really don't care about. They're not like really my customers. They just got to do what I do, and I make a bunch of money, and then my actual customer makes money. Yeah, I'm going to flip that switch. Terrible, right? But like, okay, I think the part where it's like, oh, that's just like really egregious is the merger that happened, and let's just continue to double bill. That's pretty bad.
I mean, it gets especially bad when Simpler is hosting a Becker's healthcare symposium on healthcare integration, and they can't even integrate their own merger for vendor credentialing in the healthcare. Honestly, they should be embarrassed at this point, but they're not, because they're going to continue cashing checks and sponsoring golf pros, and it's bad.
That should be, that's a post right there. You should absolutely be calling that out. I'll like that post. I would encourage you. I think you should absolutely do awards and do a carousel. I would just say do it.
Just get some awards on there and see who the top offenders are. It's amazing also what you can do with AI and ChatGPT and creating images. That's been a remarkable thing to look at. You can create some very, very stunning imagery that way.
I mean, you absolutely. Well, if you really want to have fun, go on Grok, because that's probably the most unhinged of all of them, and like let it have it go off of like PC mode.
Be a little scared, but
I know. So of all of those, is there anybody else?
I mean, as we're sticking to vendor credentialing. I mean, I think that's the startup point, and then I'll be curious to see what happens with this HCA True Access model and what that looks like. Because they're just taking all of that money for themselves, but if they're somehow able to get their entire HCA systems under one banner, maybe it actually gets rid of different systems within their umbrella having different vendor credentialing and works out to be okay if we want to look at as an optimistic point of view. But I mean, as I look at it, the cream of the crop as far as bad actors seems to be rep scrubs, green security, and then simpler IntelliCentrics, and it's a hard mountain to get to the top of, but somehow they've done that.
Yeah. And well, just as we kind of wrap up, I appreciate you, again, you're practicing clinician, you have a wife and 5 kids. And so we appreciate you spending some time with us, but I wanted to ask you now with all this vendor credentialing in place and how difficult it is to be in the hospital. I feel like what's become more important is how reps sell and prospect these days, being better about using not just social media like X and LinkedIn, but also just in the quality of emails they send and the kind of content they provide. Like, do you have any advice to reps in terms of how they can be better in terms of introducing new technology to physicians, and how do they engage better just to get meetings, rather than like the old school way was like, oh, just show up to the hospital and like stalk the doctor, the cafeteria, that just work.
I think the days of stalking and scrub sales pitches and stuff should kind of go away. I don't think those are very effective at all. I think trying to post and create interest in what you have and what solutions you have out there, doing some homework. There's some different even rep AI programs out there that you can work to figure out what your target is actually using, what the potential advantages of your system are over the top of that. And then, try to reach out even a little bit on social media. There's been some things that I've started using a little bit or looking into more because people have reached out, try to figure out what problem you may be solving for them, how you can help that. But just find out more about what people are in need of, and don't try to create a problem for your solution. Try to see what problem they have that you have a solution for. And then try to develop a little bit of a relationship, a little bit of a rapport, comment on some posts if they have them, or reach out to them either LinkedIn or through their office and try to go through those channels. The staff always likes it. There's a little bit of a lunch that can show up. You don't have to buy for the whole office, but pay for a little bit of that time goes a long way to grease the skids to be able to get some face-to-face time, and be ready to go. We have a very succinct, this is why this is better, this is why you should use it, and this is the potential advantage to your patient, to yourself, and to the facility.
Last thing before we let you out, wondering if you can share what's been the best example of a rep who was selling to you and they were successful. What kind of things did they do that helped them stand out and everything? So if you can cover that, and then let's end on the absolute worst experience you've had with a rep. I gotta make this a little entertaining. The Red Hat Gate, they're an unruly bunch of people. They sat through almost an hour of like really high level educational investigative journalism. We gotta give them a little something fun for the home. So start with the best.
Something fun for that. Probably the best has been sort of the long play. Recently, obviously done a ton of Mako and Stryker and robotics over the last decade plus of my career, and sort of trying to expand on what the potential looks like for that. One team hired away everybody that I worked with from Stryker and Mako to form their own team. And it's come down to, the personal relationships I have with them that I'm probably going to go over and start exploring that company and be after 2.5 years. And really want to have that day-to-day team back. And so that's been probably the most successful long-term play that anyone's made, to give me the opportunity to make sure that I'm comfortable with what they have to offer, and that it's better for the patients and a better system overall, and to have that belief built in. So that's a long play. Probably the worst was sort of early in the Mako days. They kept trying to sell surgeons who were doing direct anterior approach on posterior approach principles, and didn't quite understand why we didn't believe in them and why we should always do posterior approach and combined anteversion, and that's sort of a lot of those old Larry Door things that as an anterior approach surgeons we didn't really care as much about, and sort of watching the early days where they were trying to sell that robotic system for the hips to anterior approach surgeons with the posterior approach idea. So you got to understand your audience and understand what problem you're trying to solve, because they were barking up the wrong tree in a lot of those cases.
Got it. I love it. Yeah, that's really, really good advice for everybody here. So, Dr. Blackwood, again, I want to thank you for coming on the show. For those who are listening and not yet following, be sure to follow Dr. Blackwood on LinkedIn for more fantastic posts, including the Batty Awards, worst of the worst awards. I'm sure you can use ChatGPT to come up with better names than that. And then for those who are interested, if you have any questions or comments about this, aside from YouTube comments, Spotify, there is a comment section, so you can leave a comment on this episode. Let us know what you think, and if we'd love to anything out. And be sure to forward this on to your fellow Red Hat gang member. And more importantly, I think take action on Dr. Blackwood's advice, and more importantly, speak to your facility, and hopefully we can sort of develop a really strong community to, affect change here.
No, I think that's great. Thanks again for having me on. Really appreciate the conversation and the support for what we're just trying to get exposure to.
Absolutely. Thank you, Dr. Blackwood.
Thank you.
Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who would really enjoy and appreciate it. Share and spread the love. We'll see you all next time.